Is breathing easy, as simple as it seems? Breathing is something we do without a second thought, a fundamental rhythm of life. Yet, the way we breathe, specifically whether through the nose or mouth, can have a profound impact on our health and well-being. This seemingly simple act, often overlooked, can hold the key to understanding various health issues. While nose breathing is the natural and optimal way to breathe, mouth breathing, especially habitual mouth breathing, can signal underlying problems and lead to a cascade of health issues. It's a condition that affects both children and adults, often with different manifestations and long-term consequences. In this video, we will discussing the causes, symptoms, and health impacts of the mouth breathing. We'll unravel the crucial differences between nose and mouth breathing, highlighting why breathing through your nose is inherently superior. Furthermore, we'll navigate the distinct ways mouth breathing affects children and adults, emphasizing the importance of early intervention. Finally, we'll explore various treatment options and preventative measures, empowering you with the knowledge to breathe better and live healthier. Why we mouth breathe. Uncovering the causes. Mouth breathing, at its core, occurs when we breathe primarily through our mouths instead of our noses. While occasional mouth breathing, like during strenuous exercise, is normal, persistent mouth breathing often signals an underlying issue obstructing nasal airflow. Several factors can contribute to this obstruction, ranging from anatomical abnormalities to allergies and infections. One of the most common culprits is nasal congestion, often caused by allergies, colds, or sinus infections. These conditions inflame the nasal passages, making it difficult for air to pass through the nose comfortably. Enlarged tonsils and adenoids, particularly common in children, can also obstruct the airway, forcing them to breathe through their mouths. In other cases, anatomical variations like a deviated septum, nasal polyps, or a narrow palate can physically restrict airflow through the nose, leading to habitual mouth breathing. Beyond these physical factors, habits also play a role. Prolonged thumb sucking or pacifier use in children can disrupt the development of the oral cavity, contributing to mouth breathing. Understanding the root cause of mouth breathing is crucial for effective treatment, as addressing the underlying issue is often the key to restoring normal breathing patterns. Telltale signs. Recognizing mouth breathing symptoms. Identifying mouth breathing, especially in its early stages, is crucial for preventing potential complications. While some signs are obvious, others can be subtle and easily overlooked. One of the most noticeable symptoms is, of course, breathing through the mouth, even at rest. This is often accompanied by snoring, especially in children, as the relaxed tissues in the throat vibrate during sleep. Dry mouth is another common indicator, as mouth breathing bypasses the nose's natural humidifying process. Children who habitually mouth breathe might exhibit specific symptoms, including changes in facial features. Chronic mouth breathing can alter the development of the face, leading to a longer face, narrow jaws, and a high-arched palate. These children might also have difficulty concentrating in school, experience restless sleep, and bedwetting. In adults, mouth breathing can manifest as morning headaches, fatigue, and daytime sleepiness. It can also worsen sleep apnea symptoms and contribute to dental problems like gum disease and tooth decay. Recognizing these signs early on allows for timely intervention and can prevent the development of more serious health issues. A domino effect. Mouth breathing's impact on overall health. Mouth breathing might seem harmless, but its effects extend far beyond just the mouth. It can trigger a chain reaction, impacting sleep quality, dental health, and facial development. One of the most significant areas affected is sleep. Mouth breathing disrupts sleep quality, leading to snoring and sleep apnea. Moreover, it negatively impacts dental health. Mouth breathing dries out the mouth, increasing the risk of cavities and gum disease. Chronic mouth breathing, especially in children, can influence facial development. Breathe right. Live better. Nose breathing versus mouth breathing. Understanding the differences between nose and mouth breathing is crucial for our health. Nose breathing is the body's natural method, filtering, warming, and humidifying air. It promotes nitric oxide production, improving oxygen circulation, and boosting the immune system. Mouth breathing bypasses these functions, increasing respiratory infection risks. It can also lead to sleep apnea and orthodontic problems. Growing up with mouth breathing, how it affects children. Children are particularly vulnerable to the adverse effects of mouth breathing. Chronic mouth breathing impacts their physical development, sleep quality, and cognitive function. It alters facial growth, leading to a longer, narrower face and crowded teeth. These changes affect their bite, chewing ability, and speech. Mouth breathing disrupts sleep, causing snoring and daytime sleepiness. This impacts mood, behavior, and academic performance. Early intervention ensures healthy development and proper facial growth. Not just kid stuff. Mouth breathing's impact on adults. Adults are not immune to the consequences of mouth breathing. It can impact sleep, oral health, and overall well-being. One major area affected is sleep quality. Mouth breathing worsens sleep apnea, causing snoring and frequent awakenings. This leaves individuals feeling tired despite a full night's rest. It also exacerbates dental problems. Dry mouth increases the risk of cavities, gum disease, and bad breath. Addressing mouth breathing is crucial for better sleep and oral health. Taking charge, treatment, and prevention strategies. The good news is that mouth breathing is often treatable, and in many cases, preventable. The approach to treatment depends largely on the underlying cause. Identifying and addressing the root of the problem is the first step towards restoring normal breathing patterns. If allergies are to blame, managing them with antihistamines, nasal corticosteroids, or allergy shots can reduce nasal congestion and improve airflow. Similarly, treating sinus infections with antibiotics or nasal decongestants can alleviate obstruction and promote nose breathing. For anatomical issues like a deviated septum or enlarged tonsils and adenoids, surgical intervention might be necessary. Septoplasty, a procedure that straightens the nasal septum, can improve airflow, while tonsillectomy and adenoidectomy remove enlarged tonsils and adenoids, respectively, clearing the airway. Beyond addressing the underlying cause, several other strategies can help promote nose breathing. Myofunctional therapy, a type of exercise that retrains the muscles of the face, mouth, and tongue, can improve tongue posture, strengthen oral muscles, and encourage nasal breathing. Finding the right help. When to see a professional. Knowing when to seek professional help is crucial for addressing mouth breathing effectively. If you or your child consistently breathe through the mouth, even at rest, it's essential to consult with a healthcare professional to determine the underlying cause and discuss treatment options. Start by talking to your primary care physician. They can assess your overall health, rule out any underlying medical conditions, and refer you to a specialist if needed. An ear, nose, and throat (ENT) doctor can evaluate the nasal passages, sinuses, and throat for any obstructions or anatomical abnormalities. For children, a pediatric dentist can assess the impact of mouth breathing on their oral health and facial development. They can also provide guidance on preventing further complications. A myofunctional therapist can help retrain the muscles of the face, mouth, and tongue to promote proper breathing, swallowing, and chewing patterns. This type of therapy can be beneficial for both children and adults. Remember, addressing mouth breathing is a team effort. By working with healthcare professionals, you can identify the root cause, explore treatment options, and develop a personalized plan to restore healthy breathing habits. Beyond the mouth, the importance of holistic care. While addressing the physical aspects of mouth breathing is crucial, it's equally important to adopt a holistic approach that considers the interconnectedness of our mind and body. Stress and anxiety can exacerbate mouth breathing, creating a vicious cycle. When stressed, our bodies go into fight or flight mode, and our breathing naturally shifts to shallower, more rapid breaths, often through the mouth. Incorporating relaxation techniques like deep breathing exercises, meditation, or yoga can help reduce stress levels, promote relaxation, and encourage nasal breathing. These practices can be particularly helpful for both children and adults struggling with mouth breathing. Furthermore, creating a sleep-conducive environment is essential. Ensure the bedroom is cool, dark, and quiet, and consider using a humidifier to add moisture to the air, especially during drier months. This can help reduce nasal congestion and promote comfortable nose breathing during sleep. Remember, addressing mouth breathing goes beyond just treating the physical symptoms. It's about adopting a holistic approach that considers the interplay between our physical and mental well-being, creating a harmonious balance for optimal health. Breathe deep. Your journey to better breathing starts now. Breathing, a seemingly simple act, holds immense power over our health and well-being. Understanding the impact of mouth breathing and taking steps to address it can significantly improve our quality of life. By recognizing the signs, seeking professional help, and adopting a holistic approach, we can restore healthy breathing habits and reap the numerous benefits of breathing well. Remember, breathing is not just about survival, it's about thriving. By prioritizing our breath, we prioritize our health and embark on a journey toward greater well-being.